Welcome once again to Island Foot and Ankle Surgery, and I'm here again with Dr. Ben Overley. And last time we chatted, we talked a little bit about sports injuries. And of course, they are a trauma, as you just informed me right before we started filming. But I guess when we're talking about trauma, we might go a step further where we're talking about breaking bones and things like that. So tell us about how you treat that and what our options are when something like that happens. So when we don't hear the pop, we hear the crack, then what?
Well, that's really a significant thing, and a lot of times, and there are a lot of foot and ankle injuries that are missed. In fact, people confuse them for sprains, and they don't understand why they're still swollen after 6 or 7 weeks. That should be an indicator for your audience that you really do need to seek medical care at that point. Right. So the things that we concern ourselves with in the foot and ankle are our two most common things that we see. In terms of fracture patterns, of course you have your ankle fractures, and there's multiple different types of those, which I'm going to spare you going into. But typically the fibula and this area, the lateral malleolus, is the most commonly affected. And these are typically your spin out injuries, where an individual rolls over like this, and then there's a force which takes place. And once the ligaments have given, the force transmission will then come up between the two bones and usually exit out through the fibula. And that's when we get our low ankle fractures. And of course we have broken bones up here and down here. And so people understand when you say I have a broken ankle, an ankle is a joint. So you didn't really break your ankle. What you broke is one of the three corresponding bones. And really refers to these two when we're talking about ankle fractures. Another common one is what we call a Jones fracture, which is here at the base of the fifth metatarsal bone. This is typically, this was described by a Scottish surgeon named Jones way back. This is when they first started doing x-rays at the turn of the century. He referred to it as a dancing fracture. And the reason why he referred to it is because he had the fracture and he got it from dancing poorly. Okay. So, but typically this is an injury pattern where you're walking, and this is something that can happen to you on the beach. This is something that can happen to you even on the edge of your driveway at night, and you don't really know where your foot is, and you might just crawl off of your macadam there, and your foot goes onto the grass. Okay. Like that. It's very quick, it's very abrupt, and it's a very slow healing fracture. So it is one that definitely requires surgery. Non-operatively, really, they don't heal. It's in a dysvascular area of the bone, so that's what makes it very difficult to heal. In a a student athlete could heal it conservatively, but typically once you hit your 30s and if you get that fracture, you're going to require surgery.
Interesting.
Yes. So the other foot and ankle trauma, of course, broken toes are very common. There's the bathroom fracture. That is your pinky toe. That's when you have to get up in the middle of the night and go to the bathroom, and you don't really know, you haven't woken up yet, and you're walking around in your dark bedroom, and you happen to catch that toe on the edge of your bed, or you catch it on your dresser or whatever, or even a door. Those, again, all varying severities. Most of the digital fractures, unless it's the big toe, they're all treated pretty much conservatively. We just do that with buddy splinting and an appropriate surgical shoe. Most of the fractures, and this is another just information for people that are watching this, is we really grade it in how close the fracture fragments are, and if there's no malalignment present. So if there hasn't been any shortening, if there's no angulation, if there's no rotational defect, and if there's no displacement greater than 2 millimeters, we typically are going to try and heal you with just putting you in a boot and things like that. So, and these are the fractures that I'm describing are ones that are related to a specific event. Okay, so there's a precipitating index event that occurs. Insufficiency fractures, which there's a lot here on the island because you're active, maybe you're female, postmenopausal, and if you haven't had DEXA scans or checked your vitamin D and calcium, things can happen like that. And this is more of a tear in the lining of the bone, and it is not typically treated with surgery. It is treated with just a boot immobilization and time.
Excellent. Again, I mean, it's always so fascinating when I'm here because I learn a lot. So thank you for sharing all that with us.
You're very
And again,
welcome.
We'll see you again soon.
Thank you.